Hey folks, chapter 11 in the embalming book, prep of the body prior to arterial injection. Let's look at this. So 3 general periods of embalming: pre-embalming, pre-arterial injection, our actual injection or arterial injection, and then post-injection. Kind of a no-brainer. There are usually tasks relegated to certain areas. Well, refer to chapter 1 for the chronologies for autopsy and unautopsied bodies. Let's just get right into it. Analysis, well, had a whole chapter on it. You should know what it is by now. 4 steps. What did I see? What do I do for what I see? Let me do that, and then how did it end up? Did it work? If it worked, great. Next item. If it didn't, what do I see, etc. Body condition, the skill of embalmer influence when you do certain things. We're going to look at the generalities. Okay, we're going to look at the generalities and look at some exceptions. It's important that you know the generalities and apply a lot of common sense when looking at questions on a test or professional exam. Be flexible. Rely on the condition of the body to tell you what you need to do at what times for the best possible results. Regardless, devote your full attention to solution distribution during injection. You can utilize procedures and drainage to maximize distribution. We're going to talk a lot about that in the next couple chapters. Retention of as much of the solution as possible is your objective. You need to preserve the body. Embalming is about preservation. So before beginning, before you do anything, before your analysis, make sure you're looking at the right guy. Check IDs. Okay? At least one ID tag should be kept as part of the permanent file. I'm not a big fan of that. I don't like taking IDs and keeping it. My practice has been if I got to take an ID tag off, I'll make a photocopy of it and put that in the file. But I really don't want to keep ID tags. You can keep a photo, but keep them secure and labeled appropriately. That goes into whole photography rules and blah, blah, blah. We'll talk about, stuff like that in funeral law. But for the most part, photocopy of a tag is not an issue. All documentation regarding ID, property list, blah, 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 you should keep, if not originals, copies for sure, okay, in a permanent file. And these days, with electronic scanning and secure retention of data, you really don't have an excuse not to keep some of this stuff. Embalming is the most acceptable means by which family and public can view a deceased over a period of time. The arranging funeral director should be aware of the post-mortem condition of the deceased. It is amazing how many people get this question wrong. Are funeral directors the people to embalm bodies? Everyone says, yes. No, they're not. Funeral directors arrange funerals. Embalmers embalm bodies. And in many states, there is a separation of those duties. There are separate licenses and or combination licenses which allow people to do both items. So make sure that whoever is arranging a funeral director and embalmer, if they are not the person embalming, they are the person who needs to know what is going with that body and tell them these items you see here. Height and weight for casket sizing. Visible trauma, so they don't make promises they shouldn't be making. Gross or discolorations, facial hair. You need to know if they're supposed to have the beard or clean shaven, man. If things are swollen and if there's a surgical incision where you don't want one seen. Families may wish to view without standard arterial cavity embalming. You may need to limit times of viewing. Look at your state laws. Here in Florida, you can take a body out of the refrigerated storage for 24 hours for funeralization purposes. So you can definitely do this. May request green embalming for natural burial. Non-formaldehyde-based chemicals. Hey, nothing wrong with that. There needs to be a clear understanding between everybody. The embalmer, the arranger, and the family. And realistically, the embalmer and the arranger should be speaking before the family come in, if at all possible. Whenever possible, let mechanical devices do the heavy lifting, body lifts, etc. Body should be centered with the head as near as possible to the upper end of the table. Clothing, sheeting, body bags should be topically disinfected. That means you spray the body bags before putting them in the biohazard box. Roll the body by placing hands on the shoulders and hips. Where the hips go, the rest of the body goes as well. Moving the body, always pull the body. Do not push it. So shoulders and hips, pull towards you. Do not push away. That doesn't work. So it tells you about transferring from cot to table. Come on, this is kind of a no-brainer. Read it in the book. Using a slide board obviously makes things easier for you. And it's much easier to position the body on the table while the deceased is clothed or wrapped. Skin will stick, essentially, to dry stainless steel or porcelain. So if you might want to spray it with topical disinfectant if you are moving over a quote-unquote nude body or something in a hospital gown that's half open, so that the body will slide easier once it comes over. If possible, remove clothing without cutting. Some places, some businesses will launder it, dry clean it, and give it back to the family. Again, follow your established protocols. Check clothing for valuables. If you do have clothing and you are embalming someone, be very careful when checking pockets. You never know what you're going to find. But check the pockets nonetheless, because you want to make sure that you have an accurate log of anything that came in so that you can catalog it and return it to the proper individuals. If there's something you cannot remove, especially metallic bands such as wedding rings, etc., you need to cover those with tape or something to protect them from reacting with the chemicals we use. And anything we can possibly remove from the body, make sure you do that. Make sure you ask permission, especially when it comes to things like scapulars or rosary beads. Some people may want those with the person at all times, and you may have to explain. You can substitute and then replace. That is something common to say, I want them holding the rosary the entire time. Ask permission and say, hey, can I put a disposable rosary during embalming because we don't want to damage the nice one that you have? If they say no, then make sure that you maybe cover it with a plastic bag and tape or something. You know, do your job and perform due diligence is what it comes down to. So evaluate your situation. Lock the wheels on cots or tables, and if you even think for a second you need help, go get help. Here's a hint. You should be moving bodies with 2 people anyways. Technique, if you're going to lift, you should, read this on your own, but lift with your legs, not with your back. Screw up your back, and you will pay for it for a lifetime. Know your limits. Don't attempt to lift something if it's too heavy. Don't try to be macho man, okay? If you do need to do some heavy lifting, grab a team to do it. Have good communication with team members. It is what it is. Primary disinfection, follow the label and manufacturer's guidelines for contact time. Spray everything, all orifices. Get down and dirty. That's part of the job description. Remember, you wanted to do this. Droplet sprays are preferred over pressure sprays. Basically, spray bottle. You want a heavy spray bottle so when you squirt it, it goes and it pulls stuff down with gravity. If you use something like a pressurized air hose or you might aerosol it, you might not blow it off the table. That's the whole thing. You don't want to be inhaling things that you shouldn't be inhaling. Disinfection should include getting rid of the critters. If you have lice or maggots, that is an important part of the job, especially because it's going to affect your body. Now, if it's got, cooties, you probably don't want to get the cooties on you because if you infect it, you're going to be doing the shave of shame. For fly eggs and maggots, well, you're going to be using probably petroleum products. You want to get those guys out because they turn into flies in 24 hours, continue to lay eggs. And you're going to be using a larvicide. Don't just go in there with your primary disinfectant and think it's going to take care of maggots. You need a larvicide. Prevent flies from laying eggs by packing nostrils, covering the body. If you do have windows in your prep room in some of the older facilities, make sure there's screens on them. Once eggs develop into a larval stage, they're nearly impossible to control. Once you get buggies, you have issues. Wash the body with warm water and a germicidal soap. Get all the crap off of it, basically. Pay special attention to visible and viewable areas. And keep your eyes open. You're performing an embalming analysis at this time. If you have some scaly skin, use some dry hair shampoo. It's basically acetone. Might want to use some massage cream to give it time to loosen things up and then attack it. Go through this laundry list. There's a lot of stuff here. And the big thing to remember is that if you're using bleach or sodium hypochlorite, be sure to get rid of all of it before using formaldehyde because they can form something that's bad for you. If you're cleaning things, do not break skins. Be careful when manipulating eyelids. Be careful when cleaning fingernails so you don't tear something you shouldn't. Know your solvents for your stains. Okay, that's important. The less you have to abrade something, the easier it's going to be to restore it later. Hair can be washed at the beginning and at the end. You should be doing both. First wash to make sure you get rid of all the big stuff, and then the second wash to make sure that you get rid of anything that you might have put on during injection and anything you might have missed. Use warm water and a good germicidal soap or commercial shampoo. Just run down to your favorite big box retail store and grab the cheapest thing they got by the gallon and just use it. If you have issues with ethnic hair, hire someone to come in and do it. I mean, it's not rocket science. You go out and you get a licensed cosmetologist to do the hair for you. And if a person has dreads, their hair still needs to be washed. Don't say, oh my God, dreadlocks, we don't wash that. If you have a problem with ethnic hair, find someone that does not have a problem to assist you. Ask them, tell them what you need to do to prepare it for them, and away you go. It's not hard. Last thing there, when in doubt, brush or comb it straight back. So if you have no idea what's going to happen with hair, Comb it out straight, except for the bangs. From a professional standpoint, I am telling you, keep the bangs down and over the face. If they want to comb it back straight later, they can. But if there's going to be any styling whatsoever, by combing it forward over the face when you're done, and then they comb it back, it'll have that nice natural poof that you're looking for and that you get in real life. When hair is very thin with the tendency to fall out, dry it before combing or brushing and avoid as much manipulation as possible. This leads me to another side note. Get brushes to do the job, okay? For nearly 40 years of my life, I had regular, good, white Republican hair, okay? Now I'm growing a ponytail so I can actually, like, donate it to kids that are sick and want red hair because, you know, red hair is badass and whatnot. The fact of the matter is, long hair and ponytail, oh my God, I want to kill myself. This is such a pain in the butt. I didn't have the right brushes. Get a detangler to detangle. Get all these different brushes that you need to do the job right so you're not ripping hair out, and you'd be surprised how much easier it makes your life. Don't comb curly hair when it's wet. Knead hair with the towel while blow drying to help retain the curl. And if you want to do this right, drop the 15 to 18 to 2,000 bucks and go to beauty school for the 6 months it is. It will help you professionally. Nothing wrong with it. After disinfection, washing and drying, packing nasal and oral orifices, and positioning the body, you can shave. Facial hair should be removed from all bodies. Men, women, and children do not shave foreheads, especially on women and children, I believe. Nostrils should be trimmed. Get in there and, you know, clip some nose hairs. Any facial hair will show when cosmetics are applied, making the appearance unnatural. Be very careful about foreheads. Some people need to shave them. Some people do not need to shave them. Look at the book and remember what the rules are regarding the lanugo, which is the facial hair we're talking about. Permissions and directions should be obtained from the family with respect to facial hair in a deceased male. You can tell I used voice recognition to dictate, right? If there's it's much easier to shave prior to arterial injection. It's a no-brainer. If the body's preserved, it's much easier to shave. That being said, you can shave after. If you have any doubt whether it is a shave or no shave situation, beard versus mustache, mustache versus clean shaven, do not shave until you know for a fact. Certain drug therapies may cause some facial hair on the forehead. Shaving can be difficult. Be careful not to nick the skin. You can use massage cream to shave, a shaving cream. You can also use some humectant chemicals. I know Dodge Company makes a humectant called Restorative, and I actually like that for shaving the faces of women, the faces of children, because it allows me to see what I'm doing much better and moisturize the skin as I go without the icky clumping of the massage cream. So the points for shaving, there they are. What it comes down to is sharp razors. Okay, more than one blade may be necessary in some bodies. Follow the rules. Follow the rules. Remember, if there's a doubt to something, don't do it. Touch it later when you know for a fact. And it keeps going and going and going. If you do get some razor burn, some razor abrasion, throw some massage cream on it if you need to help keep the brown from happening until you want it to. Apply wax following injection after you cauterize it to make sure that it's dry. You want abrasions dried out. You can cover them with wax and cover them with cosmetic if you need to. When shaving, here are the points again. The advantages to massage cream are listed for you. I would know those. You have two types of creams: greasy, which is useful with the cream mortuary cosmetics for the most part. They react very well with massage cream, and water-based creams. And understand, a little bit of massage cream goes a hell of a long way. If it looks like you're spreading cream cheese on a person's face, it's too much massage cream, okay? If it looks like they've got just a little layer of oil or Vaseline, that's probably the daily do, okay? That's what you probably want to do every day to make sure it stays moisturized. It'll clean off real nice. If you're shipping, you probably want to see a little bit of white because it's going to have to last for the shipping and the travel. You're obviously going to be manipulating the body constantly while you're embalming it. So be careful. Be careful not to tear capillaries. That's going to cause ruptures and blowouts and swelling. You don't want to do that. Careful relief will result in better distribution as well as less extravascular resistance and complications for you later. So the routine procedure, and it tells you how to do it, how to relieve the rigor. Everything. Jaws, arms, fingers, feet, legs. You need to know how to do this stuff. Position the body. The head is at the highest level. That does not mean you have the chin touching the sternum. Just means that with the body on the table, the head should be at the highest point. The chest is next and the abdomen is the lowest. Should be in a laying position near the center top of the table, so you have plenty of room for positioning devices. Carotids can be raised by standing at the head of the table, and that's important. That is important. Even in other chapters, you're going to see this. If here's your table and here's your body, right, you should be standing right here to access your carotid arteries. That's why you're going to see how direction of suturing and all sorts of other stuff, because it relies on you standing at the head of the table to do things with the carotids. So it tells you how to establish the higher, mid, lowest. Buttocks on the table or a body bridge under the shoulders, and definitely head blocks or something under the head. You might even use a body wedge. The wedges are these really big wooden contraptions that basically put the body almost sitting up. You can have some really great effects embalming with those things. You want to get the head up, okay, about 4 inches above the table, because that's going to cause the blood to gravitate down into the torso. It's going to reduce the risk of formaldehyde gray, a reaction of formaldehyde preservative with blood to turn things gray. It's going to help air circulation. It's going to help you with water migration. The water will gravitate out, so any swelling in there because of water will go down as well. There's so many reasons why you want it. And now important, operative aids versus manual aids. If it requires cutting in any way, excision, incision, channeling, it's probably an operative aid. A manual aid is anything else. It's not hard. Memorize the operative aids. Everything else is probably a manual aid. Shoulders are elevated, and here are the reasons. Okay, shoulders are elevated. Here are the reasons. A lot of them are what we talked about with the head. You have to get creative if the body's arthritic or has contractures. Okay, contractures are when a muscle hasn't been used for so long, it actually just kind of locks into place, if I recall correctly. Head blocks, fluid bottles, whatever it takes to position the body right. Custom's going to dictate how you position the body. Now, obese people should have your chin slightly elevated to make the neck look thinner rather than having the whole frog syndrome going on. That would be an important thing to remember. If the left side of the face has disfigurement, keeping the face straight will assist in positive viewing. You might want to set up some little barriers so people only see the best side of the face, or a casket veil or something. We'll talk more about those in other courses. Hands should be placed on the embalming table or even lowered over the table prior to injection, which forces the blood to pool in the capillaries. I am a big, big, big fan of dropping the arms over the side of the table, and then after distribution has been established, putting them in the viewing position. You have to pay attention to that because you do not want the arms to firm and the open arm Superman thing that's going on there, okay? I'm a big fan of that, but you have to pay attention to what you're doing. Custom dictates how the hand is. Book says use a sheet or large towel underneath the hands. Fingers should remain together and slightly cupped. Large ball of cotton, small cloth. I'll tell you what, cut a racquetball in half, and that usually works pretty good to make your life happy in regards to keeping the fingers together. Legs and feet are important as well. Keep the feet together. You might have to get some casket webbing or a towel and tie them together. Some embalmers prefer to elevate the feet. I am one of those some embalmers. Keep the feet as high as possible, so literally stuff pulls back into the abdomen, which again will allow me to take out any edema and establish maybe some better distribution in the legs. Note any size issues. Note any size issues, because FD wants to get a comfortable casket. If you got to get oversized caskets, get it. For every X, it's 2 inches to width, 3 inches to length. Every casket manufacturer has a measuring device that will give you free of charge to measure so you can purchase the right product from them. So make sure you get those calipers and you are ready to go. Flexing the toes, omitting shoes, flexing legs may help you get them in a casket, but realistically you should be buying the product right. Now, in the book, the orange cover, it's worth mentioning that the chart says standard size of a metal casket is 79 by 24. I'm hoping that's a typo because that is the only place in existence I've seen that number. The correct size is 78 by 24. Please make that correction and study that for your test and your professional examinations. Strokes, paralysis, contractures, coma, blah, 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 blah. Make your job a lot harder regarding positioning. And it tells you things that you might need to do to fix things down and get them positioned right. The big thing is that you know not to tear and cut and go crazy with things unless you get the proper authorization. We don't necessarily go in breaking bones and cutting tendons and ligaments without family permission. That is not something that is done in normal embalming techniques, so you do have to get extra permission to do it. So manual aids, again, if it's not cutting, incising, or anything to do with a trocar or scalpel or scissors, it is probably a manual aid. And operative aids for positioning are the last resort. That is the cutting, etc. You can still get good results for carotid injection despite contortion of arthritis or whatever. Being arthritic, being contracted, whatever it is, has little to do in the long run with actual injection. It's more about positioning. Okay? You can hide some of the issues with these positioning things with blankets and whatnot. So explain options to a family. Educate them on the situation and let them choose what they want to do. It's their decision, so let them make it. Autopsy bodies, well, it tells you everything you need to do for autopsy bodies. Try to keep the arms in the right position before, during, and after embalming. Tie the arms in proper position, especially on a ship out, because of the fact that if it firms, great. If it doesn't, you know, it is what it is. I've noticed I've always had problems positioning an autopsy body, especially the hands, keeping the fingers together and whatnot, just because of the reaction with the formaldehyde and the time delays and even the trauma of the death. Setting features is generally a pre-embalming treatment. Okay, pre-embalming treatment. You can temporarily set them prior to embalming, and then you can firmly set them when you are done. Although related, mouth and lip closure are different items. Mouth closure raises and holds the jaw in position. And we do that via the needle barbs. We do that via the wires. We're going to look at that. Lip closure regards making the lips look natural. So mouth closure suggested order, relieve, clean, remove and clean dentures, pack the throat, then put everything back. Put everything back once it's nice and clean. Try to observe a natural bite. And then secure the mandible by one of the means of closure. Place the lips in desired position, embalm, and away you go. 4 conditions of the mouth: toothies, some toothies, no toothies, but fake toothies, and no toothies at all. Okay? Dentures. Dentures are personal property. If they come with the body, they should stay with the body. If you can use dentures, use dentures. Okay? It's as simple as that. You can add dentures later, but you really want to try to have them for the time when you're preparing the body. Now, liability point. If you say you're going to use the dentures and you take them in casket, or you take them and you put them under the pillow, you did not use the dentures, and you can get sued for that. If you tell them you're going to use them and put them in the face, put them in the face. Because if they want to see that you did it, you created a contract. You created a contract in various ways in the funeral when you sign the contract, the physical contract, and when you promise to do something that they're asking you to do, you owe them a responsibility to do it on several different levels. So make sure you do what you're told. Lips. Remove scabs and all sorts of other good stuff with massage cream, solvent, or warm water. Drain blisters. Tells you how to loosen up tight scabs. Observe the weather line. Determine thickness of lips. If you can find a photo, that would help too. Usually the upper mucous membrane, quote unquote, the upper lip, is generally longer and thinner than the lower mucous membrane. Okay? And remember, that is the red pores. That's where the lipstick goes. Buck teeth, prognatism, woohoo! Hail Billy! Consult family to ensure teeth should be or not be visible. Okay? Taking things out of order from your book here to make things more linear and make sense better. Secure the jaw, traditional closure methods, and then do one of the things it lists here. For the most part, super glue is going to be your friend. I recommend the super glue gel. You can buy this stuff for next to nothing at like Harbor Freight or whatnot, you know, your generic tool stores. Don't be afraid to use the stuff. So needle injectors. Needle injectors, well, tells you how to use needle injectors. Use needle injectors. Not hard. Sutures. Musculature suture. I am not a big fan of the musculature suture. I know some people are because it doesn't put the hole at the bottom of the chin. It is what it is, okay? I think it pulls out more often than not, so I don't like it. Open the mouth, raise the upper lip, insert the threaded needle at a point where the upper lip joins the maxilla under the left nostril, draw needle out of blah, 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 blah. Fact of the matter is, you are going to pull through that mentalis muscle, right? You're going to pull through the mentalis muscle, and then you're going to run it into one nostril, through the septum, back into the nostril, under the lip, and tie everything on the inside. Primary disadvantage is the puckering at the chin. If you keep the needle close to the bone, you shouldn't have an issue to do that, but that can be difficult in some faces. I am not a big fan of it. The sublingual suture starts with the same upper, okay? All the sutures use the same type of upper. You push against the maxilla and come out a nostril, go through the septum of the nose, go back in the nostril, pushing down against the maxilla and coming up right above the gum line, above the upper teeth. What differs in all the sutures is the bottom attachment. The sublingual grabs the base of the tissues under the tongue to eliminate the pucker at the chin. I have never done one of these. The mandibular is my favorite because if you set the mandibular is done. It will not open. It will not pull through because it's right up against the bone. So the upper is like normal. Whole nose thing is the same. However, you're not going to start with the upper, okay? What you're going to do is you're going to start with the lower. And different size needles work better for you. I like using one of those medium to small S needles, autopsy needles, double curved needles for doing this type of suture. Open the mouth, insert the needle at the center point of the mouth at the base of the tongue behind the lower teeth at a point where the floor of the mouth joins the gums. I have found that trying to go too far back makes the hole very visible. Too far forward makes it hard to manipulate the needle. Find the happy area. Push the needle downward, exiting the point where the base of the chin joins the submandibular area. Reinsert the needle in the same hole at the base of the chin you just made. Essentially what you are doing is wrapping the thread around the bone. Keeps going. I'm going to go to the next slide. I'll demonstrate it here. If here is your mandible, and this is a very crappy version of a mandible, what you are doing is you're going to get the needle through here, okay? And then you're going to come back in the same hole. We're going to, for the sake of argument, here are your teeth. I know, great artist rendition. And then pull the rope up this way. And what that's going to do is it's going to, you know what, it would be more appropriate. Yeah, we'll just leave it there, okay? This is the bone. Let's put the teeth in the right place. Teeth should be right here, okay? Then you're drawing and you're going to bring it up this way. So essentially, you have wrapped it around the entire bone. Once you pull things through, pull the thread back and forth to kind of saw through the soft tissues of the lower jaw so it rests right up against the bone, and then do the top portion like normal. What this allows you to do is hold the bone in place, and once it's set, like I said, it never goes. If you come to my school and go into my embalming lab and I am your teacher, this is the only thing that you learn to do while you're in school. Because with this, you can pretty much practice anything else on your own time, but this gets it done and it never has to worry about it again. If the hole is visible, you can put a little daub of wax on there to hide it. You can even super glue it. If it's within a wrinkle, you can actually just close the wrinkle. There's so many things you can hide it that I actually prefer this over every other feature there is. The dental tie, you're basically needing to have natural teeth for this. If you don't have natural teeth, it's done. The game is already over. You basically tie a ligature or dental floss around teeth, one on the top, one on the bottom. You tie them together, it holds the jaw in place. I'm not a big fan of this because I just think it falls off. Opposing incisor teeth are generally used, but any front teeth can be used. Variation can be used to tie a dental tie on the bottom and musculature suture on top. I don't see the point of tying something around the tooth, but again, it doesn't make any holes, doesn't pucker the chin, whatever. Drill and wire, yeah. For the most part, this is for the trauma case. Okay, you should not be going out and grabbing your 18-volt DeWalt and drilling holes in people's maxilla and mandible. So fact of the matter is, gives you, what you need to do, and realistically, this is for the trauma case. Chin rest, 2 small prongs were inserted in a nostril, and the slide goes under the chin, and it's because you would brick them really, really hard with arterial chemical. If you didn't, it would open right back up. Gluing is usually limited to infants and children. Lips are sealed prior to arterial injection. After fluid is firm, you can unglue, clean, and reseal mouth. So make sure you have the appropriate solvents. This is not recommended for adults. A bow may be tied for ligature for adjustment later. I always tie a bow for ligature to adjust it, okay? It's something that you practice. It just is what it is. Once the lips have been brought into position, the embalmer must create an acceptable form. The mouth and lips should resemble a horseshoe shape. Natural teeth create a foundation. And if you need to fill some things out, use some cotton. That helps with emaciated bodies. If some teeth are missing, you could use K-POC, or you could use mortuary putty or non-absorbent cotton to fill in the missing teeth. Notice that says non-absorbent cotton. That's important. If you don't have teeth or dentures, pack is normal, secure your jaws, use a mouth former. Put the mouth former in and away you go. Trim formers is necessary. And if you have to, do whatever else it takes to make it look natural. I mean, like I said, this is not rocket science. Make it look the way it's supposed to, and you will be fine every single time. Come on, man. Dentures but not teeth tells you what to do. Sometimes you can use only one denture for whatever reason. You might only have one denture, in which case grab a mouth former and trim it. Again, not rocket science. If the mouth is held in place by rigor, do something. I mean, don't go out of your way, especially if you can't break the rigor. But for the most part, disinfect, inject, and if you need to, set the features later. Center of mouth should have the most projection. Talks about modeling the mouth. Tells you about filling things out and using tissue builder to help fill out the angulus oris eminence. You're going to learn more about that in restorative art. That's a little peeky thing on the angles of the mouth. One thing that I have found really useful is the massage cream on the lips. Now, that was something that my first proctor, Pete, taught me, that every person after that then taught me. A little massage cream on the lips holds the lips just sticky enough. With eyelids, the upper eyelid is 2/3 the closed eye. Lower lid is 1/3. So fact of the matter is, if this is your eye, and I know it's a really bad rendition, your eyelid should not do that. Your eyelid should do something more along the lines of this. The top part needs to be more than the bottom. If it's not level, the eye is not level, I'm sorry. The eye is not level. The inner corner or inner canthus, the tear duct, is slightly higher than the outer canthus or outer corner. General procedures for clothing are listed for you. It talks about disinfection. And watch out with eyes, because you can get herpes, Creutzfeldt-Jakob, or conjunctivitis, and you certainly don't want to catch pink eye from a dead guy. You'll never live that one down in the prep room. Gives you the general procedures for clothing. Read this on your time. This is going to be parroted in a bunch of other chapters. If eyelids do not exhibit good distribution, cavity fluid can be placed on cotton under the lid and then glue the lid shut to let the cavity fluid do its job. Difficult eye closure, emaciation, dehydration, all these sort of things. You can try to fill an eye out using some tissue builder. You might need to go in with a scalpel underneath and kind of pull the eyelid away from the scalp to make it fit. But worst comes to worst, you might have to just fill it in with wax. And very important, eyelids abut. The general thing is eyelids should abut. That means if here is your upper eyelid, your lower eyelid, as you can see, it touches it, it seals it, but it's not overlapped. Now, in certain cases, trauma, maybe even things like this, you may have to overlap it where this top part, and it's very hard for me to fill things in because I can't autofill with the laser pointer, you cover the bottom. Generally, you don't want to do that because it doesn't look natural. But you can in very bad situations. And then if you can, put some glasses over it. If you put a pair of glasses over eyes you've had to open because of whatever reasons, generally it will mask that. It talks about dehydration, basically massage cream or a humecting chemical on some cotton or an eye cap. When in doubt, glue the eye shut if you need to. I don't like doing that because if the glue gets into the eyelashes, it gets disgusting. It messes with cosmetics. But again, This is part of the job I signed up for. So I don't have to like it, I just have to do it. Orifices, hey man, again, this is what we do. Make sure you disinfect and pack anal and vaginal orifices. This is a part of the job, and a lot of funeral homes that don't do this. You know, they're the plastic plugs that make things just so easy to do. There is cotton, which I know apparently costs about as much as a pint of blood for some people. But realistically, you need to do this. Some embalmers do this after embalming so that any discharge can be addressed by, you know, come on, you don't want things leaking, especially this stuff of all things. Ears should be clean and packed. Throat and nose should be done prior to injection to prevent purge or whatever. If you anticipate they got stuff coming out already, you can just let it kind of come out and pack it afterwards. Again, there's so many different ways you can do it, but generally you pack nose and throat prior to injection if you can. I'm going to jump back just to packing the orifices. Make sure you know your state laws. On our faculty, Professor Loera, he is licensed in the state of Texas. One thing I didn't know about the state of Texas is that under their laws, the orifice in the shaft of the penis needs to be packed. That is considered an orifice. So know your laws. If you need to pack the shaft of the penis, then do it. That is your legal obligation. You don't want to be held liable for something you know you should have done under state law. Invasive devices, well, you can pretty much yank these out whenever you want. Some require removal prior. Some you should leave in place. Rule of thumb, if it's going to affect a visible area, mark the face, mark the hand, whatever, you should probably get rid of it prior to embalming, especially if it's on the face. If it's on the hand, a bit more leniency may be given there. Devices need to be disposed of in the appropriate containers. In this case, all invasive devices are considered biomedical waste, so put them in your biomedical disposal. Pacemakers, for the most part, you can leave these in during embalming, leave them in after embalming, take them out later. It's up to you. My personal preference when I was doing pacemakers is that I would leave them in during embalming, and immediately prior to cremation, that is when I would open them up and take them out. And simply because if I make the cut then, it's not an issue of leaking anymore. The body's about to be cremated. I don't have to worry about something bad happening. It says leads can interfere with drainage if using the internal jugular. The leads are passed through the subclavian or cephalic vein. I have embalmed so many bodies with pacemakers. I've never seen that is an issue, but for the most part, the book does advocate you should take it out because it may interfere with drainage. They do, however, have to be removed prior to cremation, and this is a tricky spot, okay? You need to obtain permission for the removal. Most cremation authorizations will I'm not going to say automatically, it's one of the sections of it, but most cremation authorizations have a spot on there that expressly authorizes this removal. What you need to make sure of is that when you are working on just embalming, that this may not be covered just by your generic embalming disclosure. Which is another reason why I prefer to remove this after embalming, okay? Because then there is no doubt, especially if you haven't had family come in, you know, they may change their mind, you remove the pacemaker, and that wasn't necessary for burial. It's just one of those, you know, little things that I always think about reducing my liability. Surgical incisions, check the suture to see if healing is done, and then go through the steps. Basically, you want to seal these up. You want to remove the staples. If you can, you know, is what it is. Feeding tubes, remove them prior to embalming as they can mark the face and or mouth. Breathing tubes, yes. Most feeding tubes that I've seen these days are inserted directly into the abdomen. I just kind of leave those in place if they're not going to hurt anybody. And there they are right here. I prefer after embalming, just me. I usually end up using the hole for my aspiration instead of the standard point of entry, just so I don't have to make an extra hole. But again, that's just me. Drains, same exact sort of thing. Remove prior or after embalming. I would just do it afterwards. No harm, no foul at this point. Use a purse string suture or trocar button to close. This should be done prior to cavity embalming. Catheters, leave IVs until after arterial embalming is completed. Use a scalpel to increase the openings and removal, and use a trocar button to close. You can use super glue in lieu of a button in the visible area. Trachs, you definitely have to get rid of these prior to embalming. Disinfect after removal. Okay, these are going to mark the face. You're probably going to have to get these out of the way because they're going to cause problems. Close the openings after arterial embalming, but prior to cavity embalming, as this will let purge out instead of it coming up through the mouth. Ostomies are a bit more of a pain in the butt. Follow the directions. And urinary catheters, you can take these out prior. I just do to get them out of the way so I can put on my modesty cloth. And female, you're packing the urethra with a cavity pack, it says. I handle that during my AV closing orifices when I am done. Any of these items where you move, remember, biomedical, it goes in the big red box. Cast and orthopedic devices, these should be removed prior to embalming if you can. You may have to call a local clinic to have someone bring over a saw if you don't have one. But be aware that you probably need to take care of these things. Prior to embalming so it doesn't guck things up. Read the instructions. Pre-embalming treatments, important concepts. Read this on your own. But most of these treatments involve one of three chemicals, carbolic acid or phenol, cavity fluid, or autopsy gel. Precaution should be taken for all pre-embalming treatments. So control odor, evaporation. That way you don't inhale the bad stuff. Hypodermic syringes should be cleaned with tissue builder solvent because water is going to mess it up. 17-gauge needle works best for treatments. Utilize hidden points of entry for facial treatment. You're going to learn more about this sort of stuff in restorative art. Determine your discolorations. Know the treatments for livor mortis versus postmortem stain. If you push on it and it clears, it's intravascular, it's livor mortis. As simple as that. Bruises are extravascular. Any extravascular situation must be bleached. You cannot just sit there, inject it, and expect it to go away. Skin lesions or ulcerations, treat these immediately prior to injection. Get something on them to help reduce your exposure. Disinfect, put some gel and some plastic with some cotton on there, dry the tissues, and it helps deodorize. Lesions and ulcerations generally are a clue that there is some type of really bad thing going on, so you're going to want to keep yourself safe all the way. Lacerations or jagged tears. Jagged tears. Do not confuse these with a nice clean cut. Lacerations are not that. So pre-embalming, clean them, align them with sutures. Cover the area with massage cream because anything that leaks out is going to stain, especially in a visible area. After embalming, there's the treatment. Dry them, treat the edges to burn or seal them off, and then suture them shut. If it's a non-visible area, suture tightly. If it's a visible, you might have to change the game up with the type of suture as well as some other treatments. You're going to learn more about that in restorative art. And there is a restorative art section in your embalming book after the first 25 chapters. Fractures, well, you can kind of figure those out by touch or sight. Align and go. Abrasions or skin removed to friction, razor burn, road rash, that sort of stuff. When they're dry, they resemble a scab, covered with opaque cosmetic and or wax. Moist abrasions, well, you're probably going to have to dry those off first before you can do anything because they have to be dry. Skin slip, blisters, all that. Open those things up. Get rid of the dead skin. Get rid of the liquid. You need dry, firm tissue to do anything. So make it dry and firm. Cavity packs, gels, etc. Post-embalming, dry it out. Air dry the area using just time or break out a hair dryer. And then use opaque cosmetic to treat discolorations. With gases, crepitation is movement of gas that creates a crackling sound. You're going to hear it by pushing. And there's three sources. Subcutaneous emphysema, which is just gas in the tissues. No odor, some swelling. Look for punctures in the rib cage. Most commonly, this is associated with heroics. They're trying to do chest compressions and CPR. Decomp, you're definitely going to have signs of decomp, odor, skin slip, and all sorts of problems. And true tissue gas is caused by a disease-causing agent. That's the one you don't want to get. Can be passed on to bodies via contaminated instruments, and is extremely deadly. It forms gas gangrene in the live body, and extremely deadly. Very strong decomp odor. Begins while the person is alive in the agonal period. It's hard to control because it goes right through their arteries and their lymph system, and you have to take extra steps for disinfection. True tissue gas, they recommend disposable instruments. You're going to have to be puncturing the abdomen to allow gas. It tells you ways you can do that. And if the face and chest evidence gas, restricted cervical injection is recommended using a half-moon incision. That means you basically give them what is proverbially known as the Colombian necktie. You cut them from right to left clavicle so that you can access both items. True tissue gas is very rare. It is very hard to control and very much problematic for you as a practitioner. Table 11-1 is a tremendously awesome reference for you. You know, you should be able to draw some of these things from memory. Edema Ascites, if you find distension, determine if it's gas or edema. If it's water, it's a different treatment than just the gas. If the distension is due to large amounts of fluid, try to remove it prior to injection to remove some extravascular pressure and increase the ability of distribution. At least that will help you, even if you can't treat it directly because it's in the abdominal spaces. Folks, thank you for your attention. We will see you next time.